Hi. So this is Lupus, part 2. I guess I'll just start at the beginning of my story. It started when I was born. Sorry, that's my cat. He's been very obnoxious today. You want to say hi to YouTube? Yeah? Come. Oh, no, he doesn't want to say hi. Sorry. He's a little rude. Yes. So, I was actually adopted and from Romania, and when I came into Canada, I was very malnourished, and so that caused some problems when I was younger. I got pneumonia quite a few times. I seem to have a really low immune system. So, yeah. My mom and dad always noticed a few things that were kind of weird about me. And not just me being weird in general. When I was younger, I got leg cramps all the time, every single night. And so a lot of doctors were like, it's just growing pains. It's just a normal part of growing up. And the leg cramps really actually started like after I got the pneumonia. And the thing is although they were like, this is just growing pains, I never grew. I'm 4'11", so, yeah. And, I also got a lot of stomach problems, which I did have as a baby as well. As well as when I was starting to enter the preteens, I started getting really bad chest pain, as well as migraines. And so they told me it was just an anxiety disorder, that I had anxiety. And that the migraines, it was probably just depression, because there was no reason why I should be getting migraines. They did CT scans, they did MRIs, and everything turned out fine. So they were like, there should be no reason why you're getting this. And I did struggle with some mental health issues, which just complicated things more. So, when I was older, I started to get this knee pain, and it was just patellofemoral syndrome, something very simple, but it took 2 years to be diagnosed. And a lot of the doctors then said the same thing too, you're crazy, there's nothing wrong. I saw surgeons, like a knee surgeon or something, and then I finally got sent to the Fowler Clinic, which is physiotherapy. It's basically a sports clinic. And, the doctor there was like, this is like classic patellofemoral syndrome. Very easy thing to diagnose. I don't understand how the doctors did not realize this. It's pretty obvious that you have it. So, she was like, we're going to start treatment for this. So I started to get physiotherapy, and the physiotherapist I was working with one day was like, I think there's something else going on here. This does not feel like just patellofemoral syndrome. I think that you should check it out. I eventually kind of gave up on my therapy. They were wanting to do surgery, but, I was just like, this is just ridiculous. I'm just going to suck up the pain and continue on with life and just not run marathons. Not that I was running marathons back then, but, just in case. Yes. So, I also struggled with an eating disorder, which is a whole other story. And after I would purge, I would often get, like, oh my goodness, it was the worst thing ever. It'd feel like somebody, like, smashed all of my joints with bricks, or took a needle, like, stuck it in my bones and started, like, sucking minerals out or something. Or probably a more understandable term, got hit by a truck. Like, it was painful. But usually it was after a bad purging episode, and the pain would go away after 1 or 2 days. So I didn't really think about it at all. And then one day, you know, I was perfectly happy. I wasn't depressed. I woke up with pain, and I thought, that's weird. You know, I wasn't purging. I've been eating fairly healthy lately. Usually this pain only stays 2 days, so I'm not going to worry about it. 2 days went by, and I thought to myself, well, it's probably just the flu then. But the thing is, the pain never did go away. So I got to the point where I just could not handle the pain anymore. I was starting to become Miss Grumpy Pants. So I went to the hospital, and I was just like, I'm in pain, don't touch me, ow. And so they right away put me on IV. They took some blood work, and, you know, the doctor was just like, you know, it's weird because you don't want to be touched yet. You know, when we do touch your joints, like, you say it's not as bad as you thought it would be. And I was like, yeah, it's because the pain is, like, inside the bone. It's hard to explain. It's not so much like a bruised bone feeling, like where you touch the bone and you're like, you know, it's more like I don't know how to explain the feeling inside. And so he did blood work, and he was like, you know, your ANA was very elevated. I believe that you have an autoimmune disease, perhaps lupus. And that wasn't the first time I had ever run by that name before. I had wondered before if I perhaps had lupus, because I was starting to get really weird symptoms. I was getting mouth ulcers. I was getting rashes in the sun. They almost were like little blisters or something. Just, you know, a bunch of other stuff. And I remember saying to my mom, you know, like, I think I might have lupus. And she was like, no. So the other thing that we were wondering was celiac disease. So I went on the gluten-free diet. And it helped a bit. But I got tested so many times, and no, negative. So, you know, I remember I called my mom, and I'm like, you know, I went to the ER, and they think I might have lupus. So I went to my physician, and she's like, high ANA does not mean that you have lupus. It means you have high ANA. She goes, you know, it could just be you have an infection. And I guess you'll have to find out the rest in part 3.